Carpenter, State Social Work Director for the Alabama Department of Public Health. Today, we are going to discuss changes in the way social workers document their work with Medicare home health patients. For many years, Medicare home health social work interventions have been documented in the Horizon system. Effective January 1st, 2015, Horizon will no longer be the place where Medicare social work documentation will be created. Instead, all Medicare home health social work documentation will be in Acorn. For those who are fairly new, you may not even know that there are medical social service forms in the Acorn system. For those of you who have been around a while, I believe these forms will look very familiar. Today I have with me Suzanne Terrell, the Area Social Work Director for Public Health Area 9. She has extensive experience in home health social work, and she will be going over these forms with us. Suzanne?
Okay. The first thing we are going to do is go over all of the beginning parts of the home health visit from the beginning to the end. So if you've been doing home health for some time, it may seem like a revisit, but from the new workers coming in, it'll start from the beginning and go through to the end. So it'll be new for you documenting in Acorn. Before the home visits, on the slides, you'll see and be able to follow along. You should be able to print these out. Some MSS will have access to Horizon still to be able to view, and this is just the system used by home health for their patient documentation. If you have access to Horizon, you can review the nurse's notes in OASIS and their OASIS before the home visit. And if you don't have access to that, you can have them to print the information for you. You may want to ask for a face sheet before you do the visit. This will have your directions on the sheet to let you know ahead of time basic information about the patient, their contact information, and directions for the home. And if you don't have the Horizon, you can get the nurses to print it for you. In planning ahead, you may want to take blank forms with you to fill in. These should be available also for you to print. You can use these as a guide during your home visit to make notations when you get ready for your documentation and to be able to use when you get back to the office for the documentation purposes. The release of information is a form you'll need to make sure that you take with you. You can discuss with your social work director if you will have these completed or if home health has already done this part for you. Some home care directors have already had the nurses have this completed. If you are not in the unit where they would have these forms for you to view, you may want to just make sure you have one signed at the home visit so that you have one on file for any referrals you may need to make to the patient. Encounter form is the form that you'll need to make sure you take with you. Your travel and the information about your visit will be on that form, and the patient will need to sign the actual encounter form. This is a copy of the release of information, what you will be getting from the home care. Either they will give you a copy or you'll get this form signed. If you take a copy yourself, you can order them from the warehouse. And this is just a picture of the encounter form where you will have the time and travel documented for your visit.
Now, Suzanne, on the encounter form, do they need to code their entire 8-hour day? Because we will have very few full-time social workers in home health.
You will not code your whole 8-hour day unless you are full-time. If you are full-time social work for the MSS portion, if you do clinic, also you will code only your time for the home visit on the encounter form. Patients will often also give different information to the providers. This is another reason you'll want to make sure that you review the OASIS if possible before the home visit. Sometimes they'll tell the nurse items that they may not think to tell the case manager, or they've told the doctor, and some of this documentation could be in there that would help you to be able to know to ask questions about some of these things the patient may forget to tell you while during the home visit. So if you review all of this ahead, it helps us clarify any conflicting messages. Review of information. such as the items in the horizon, are good to have before you do the home visit. It helps to just plan ahead and make sure you have sources if you have referrals you would need to take, if you have a form the patient would need to take to be referred. Sometimes the nurse may tell you, or it may be documented in the documentation where the nurse has that this is a need the social worker may help the patient with, and sometimes that'll be documented also. So you just want to make sure that that way, if you're going out and doing that one visit, you have your forms already ready for the patient and can help them complete those at that time. Does my patient have depression? You'll also have the nurses who will have screened the patients with a PHQ-2 and a PHQ-9. These scores are in the Horizon system, and they will be able to let you know what their scores are. And all of this information is documented by the nurse in Horizon. If you don't have access to it, the nurse can print it for you, or will be able to tell you before you do the home visit, and it may be information that's printed when they give you your referral. This will help you plan for discussion on possible referrals needed, or any information you would need, also any applications or anything for these needs as well. This is just a copy of what a PHQ-9 looks like to make sure that you're aware of what the form looks like and the information and questions that are asked by the nurse to these patients when they're doing the home visits. The next steps are, after the home visit is completed, you have 3 working days to complete all of your documentation to be printed and filed. You must have your progress note with all work completed in Acorn for all work done. The home visit is noted, but documentation for this occurs on the actual assessment. The MSS assessment psychosocial is completed with the information that you gather from the home visit, and when the plan of care is developed, and your patient or caregiver will actually assist you in this process. A case conference note should be completed in Acorn when communication occurs at any time with the patient case. Encounter forms are to be completed for each home visit, and you'll turn those into the home health subunit once you have completed the encounter forms we showed earlier. You no longer have to show the 8 hours on the encounter form unless you're the full-time. Signature labels are not required. The patient will sign on the encounter form. If the patient can't sign, a caregiver can do this also for the patient. After you've completed the home visit, you'll need to make sure that you copy all of your documentation and forward it to the home health subunit so that it can be filed in the patient's medical record as soon as the documentation is completed. This should be done within 3 business days, and it can be sent via email or by hand mail. You can forward the forms through the email system if you prefer to do it that way over the hand mail. Any other visits will need to be documented on a follow-up visit note if you had to make another visit to the home. A discharge summary will be completed if more than one visit is completed by the MSS to the patient. And discharge summaries should include the following information listed here: the patient status at discharge, the number of MSS visits completed, and identified social and emotional factors with the treatment. You'll also have impact of MSS interventions, the goals that were met or unmet, and further recommendations for follow-up if any of that applies. If there's changes in your plan of care, you'll need to make sure that you communicate any of these with the home health nurses, either also documented in the case conference note. If you're talking with them a lot of times by phone or in person, you'll need to make sure that you go in and document in your notes all the communications that you have with them regarding any changes with that plan of care. Any communications that occur with meetings, case conferences, any phone calls or emails that might occur informally in the office need to be documented in your notes as well. And all time spent on home health referrals should have an SSR entry. And you're going to code all of those to DPH 40 and 4, and the cost center for that is 098. If they are discharged or they're not eligible, once you get ready to do your visit, then what you would need to do would be document your time for DPH 48-4 and 090 if for some reason they have become ineligible or have been discharged. If a home health contacts you to assist a patient for an equipment-only need or no home visit is needed on that patient and they are not eligible through Medicare or have an order from the MD, you'll need to code all of that time to DPH 48-4 as well. Completing the forms in Acorn, these should be handouts that you can look at in case it's hard for you to see on the screen. You'll have the little radial buttons at the top. The center one shows the service visit. This is the one you'll select for the MSS assessment form, and it will automatically pre-fill in like the other Acorn forms you may have with the patient name and the employee and program information. The bottom portion where the diagnosis, homebound status, and reason for referrals and AR number, the boxes show up, you will take those and get that information off the face sheet or information that's given to you on your referral from home health. The next slide is just a continuation of the MSS assessment form. It'll go across the top, each tab, the information, the social situations, the caregiver, patient health, financial and care plan. Each one of these is just information you'll gather from your home visit. You'll fill in the radial buttons or check boxes according to what you find in the home visit. If there is a home visit section that's listed, such as safety concerns, you'll see the box and it says none needed. Try and make sure that you fill in each box. If there's not a need, then select none needed or NA. That way, anybody going through knows that it wasn't accidentally left off, that you have seen the box and there was not a need, that it was not just accidentally a box that was forgotten. And then at the bottom, you'll just select the information on patient relies on whoever that person is in the home that is assisting the patient to obtain food. Here on the example, the daughter helps, so you just list them. And if it's the patient themselves, then you can just list self. At the bottom, if there's any other pertinent information that the person would need to know that reviews the case, you'll list all of this here. The next slide is just a continuation to the next tab. It lists who's in the household. It lists the primary caregivers, and the information at the bottom just discusses the assistance they provide and their contact information to the patient. The next tab deals with the patient health. This is just dealing with if they're alert, their emotional status, do they have hearing or vision problems, and their communication and ambulatory skills and personal care needs. The next slide talks about financial. In this example, the patient did not have, they were able to meet all of their adequate resources to meet their needs. If for some reason the patient does not have all financial needs and this box was not checked, it simply has boxes that fill in that show you how much their rent is, how much the electric bill is, and helps you assist the patient to budget to meet those financial needs. The last tab is the care plan. On the care plan, you'll see problems, goals, and outcomes. The problems, goals, and outcomes, the first portion is a summary. It talks about the patient's deterioration of their medical condition and the increased complexity of care. It's kind of a summary of what's going on with the patient, why they would need the home health service, and how home health will assist them. And then you'll mark actually the skilled interventions that you're assisting the patient with by clicking the check boxes on right underneath. The frequency, if you make one visit, you'll have 1 of 1 listed and the total number of visits as 1. The care plan is completed with the patient, so the box at the bottom is to discuss where you've had conversations with the patient and family and they've actually helped participate in the care plan that you're documenting now. The next form shows the case conference notes. This is an example of what the case conference note will look like. You'll select the MSS section as the box, and then you'll complete your case conference note just like you would complete a progress note. The follow-up visit note, if you need to complete a follow-up visit, will look like the slide in front of you now. You'll just select the service visit, which has the 02 in the radial button, and you'll need to complete any documentation of why your purpose or reason for the visit was completed, and then the documentation in the boxes and tabs that follow. The next slide shows the patient status. It's the second tab on your follow-up form. The next one shows the skilled interventions, and you just will document there. You can just select to add notes and document as you would in a progress note. The next tab just shows the progress, and the next with the plan. If there's no other visits that are scheduled, then you'll just document that in that portion, and that'll complete your follow-up visit note. Progress notes are the next slide, and your progress notes are done just as they would be for any of the other programs you may have documented in as a case manager. You'll just select the MSS section on the portion where the boxes are under the radial buttons and enter your notes by selecting the Add Entry box like you do on all the other sections of the documentation for the notes. The discharge summary, if there's more than one visit, will look like the form in front of you now. You'll just select Other for this form and also MSS section and type in Discharge Summary to let the person know looking at this is your Discharge Summary note. The next slides will show you the completed forms. Once they're printed, these are what your forms will look like. This is just the patient information slide. If you need to print it before you do a home visit, you may want to print it to take the information with you as a quick guide for phone numbers or any of the Social Security information you may need for referral forms and the patient contact information for the caregivers. The next form is just an example of the progress note. The next slide is your case conference notes, and once they're printed, you'll see they look like the progress note. The only difference is at the top where you have the MSS section noted is what makes that the difference from the regular progress notes. The next form is an example of the MSS assessment that you completed once it's been printed out. And then this is a closer look at the MSS assessment down when you get to problems and goals. After the summary that you have, you'll actually see a better picture on this slide where the problems, goals, and interventions are listed. This is the format you'll need to use when you document your problems and goals and interventions. You'll state the problem, then the goal for the patient that you and the patient have discussed together, and then the intervention on how you plan to help with the patient in meeting the goal. The follow-up visit note is next. If you need to complete a second visit, this is what the form printed looks like. And it lists off where we showed the tabs. Each tab, it lists each tab under a different section here. The purpose, the patient status, the skilled interventions are all listed individually. The next slide shows the SSR and your 40 and 4 for the care coordination time spent. You'll document the mileage on your notes section and discuss the travel to the patient's home. The next slide is the SSR if it is not direct patient care. It's all other time spent with home health case management. And that's all the slides and the form.
Thank you, Suzanne. Do we have any questions or comments from our audience? Okay. Thank you for joining us today. We appreciate the time that you've taken to go over these forms. If you have any questions, feel free to contact Suzanne. That's her email information and her telephone number, or you can contact me in central office. Thank you.